Hello, everyone. Welcome back to Youthful Medicine. I am Dr. Tahir, and I am a board certified rheumatologist and a board certified obesity medicine specialist. My passion is to treat autoimmunity, obesity, and provide a lifelong tips for vitality and longevity. If you're new to this channel, don't forget to subscribe and share it with someone who might find it useful. And if you like this video, please give it a like so that it will support the channel and help people find this channel and help spread the word. Today, I am going to discuss with you about a topic which is common in rheumatology, autoimmunity, and metabolic health, and it's called NASH. NASH is a medical terminology for when our liver is diseased because of the excessive deposits of fat. The medical terminology is non-alcoholic steatohepatitis. But what it really means is that there is excessive deposit of fat on the liver. Now, let me turn my attention to this case that I would like to discuss with you. I've been managing a 62 years old female with rheumatoid arthritis. As you know, rheumatoid arthritis is an autoimmune disease that causes joint pains and inflammation, and sometimes we use medications which are called disease-modifying anti-rheumatic drugs. The drugs are usually methotrexate, but sometimes if patient is not able to tolerate methotrexate, we use another medicine called Leflunomide, which helps manage inflammation in rheumatoid arthritis, but can sometimes cause liver enzyme elevation. Now, I have been practicing rheumatology for about 20 years, and for the last 5 years plus, I've seen an increased uptick in NASH or fatty liver disease, which makes it harder for me to actually prescribe disease-modifying anti-rheumatic drugs because now I'm concerned about their liver disease, which could have been initially monitored for use of methotrexate or leflunomide. But now I'm seeing so much liver disease that I'm thinking, what is going on? And I should talk about it. So we have been managing this patient, and when she started out, her liver enzymes were normal. But in about 8 to 9 months, I've started showing an uptick of the liver enzyme elevation. And I was wondering if it could be because of the medication. But further workup revealed that there is another condition that she was suffering from, which was NASH, N-A-S-H. Now, what is NASH? Well, simply put, NASH is a type of fatty liver disease when patients have been consuming too much carbs or fatty foods, which are unhealthy fats. It leads to deposits of fat on their liver, leading to inflammation and liver cell damage. Over time, this can progress to scarring, cirrhosis, which is a really scary thing when I think about my patient, or even liver failure. NASH is part of the spectrum of what we call non-alcoholic fatty liver diseases, ranging from simply a fatty liver, which is steatosis, meaning fat deposits on the liver, to this more severe form where the liver inflammation is present, which can further lead to liver fibrosis and cirrhosis. So NASH isn't caused by alcohol. That's what it's in name, non-alcoholic fatty liver disease, but instead by a variety of other factors that are related to metabolic health. The most common causes and the risk factors currently in our day-to-day lives include obesity. Excessive amount of obesity levels in our population has given rise to this disease. Excessive weight is one of the strongest predictors of someone developing fatty liver disease. Number 2, type 2 diabetes, which is again another metabolic disease associated with processed foods and excessive consumption of high glycemic foods. Metabolic syndrome, which includes the combination of high blood pressure, elevated cholesterol, and excessive abdominal or visceral fat. Dyslipidemia, which is elevated triglycerides, or low HDL cholesterol, which also increases the risk of fatty liver disease. Sedentary lifestyle, lack of physical activity can contribute to accumulation of fat on your liver. Certain medications like corticosteroids given to autoimmune disease patients and patients commonly prescribed in rheumatology clinics, they get this medication. Now we have to be even more careful because patients are getting this. Age and gender. Older adults and women tend to have higher prevalence rates through the disease and can affect them. So regarding prevalence, NASH is becoming actually more common. It is parallel to the obesity and diabetes epidemic. So as we see the rise of obesity, as we see the rise of diabetes, we are seeing a rise of NASH. Studies suggest that up to 25% of adults worldwide may have non-alcoholic fatty liver disease, and a significant portion of them, about 20 to 30% of those patients, can develop NASH, which is now the state where the fatty liver disease has converted or started damaging the cells, and now it is inflamed. In fact, NASH is now one of the leading causes of liver transplants in the United States. So treatments of NASH has been something that they've started working on, because now scientists and clinicians are noticing significant amount of uptick in this disease. As you could guess, what recommendations would come through this is obviously lifestyle changes, integrative medicine, and sometimes pharmacologic interventions are needed. Here are some of the most effective strategies. Number one, lifestyle modification. You have to start with the basics. Dietary changes, a Mediterranean diet rich in vegetables, lean proteins, healthy fats is shown to be beneficial. It reduces the accumulation of fat deposits on your liver. If you reduce your refined carbs and saturated fats, you can help yourself reduce liver fat. Weight loss. Now, weight loss, about 7 to 10% of weight loss significantly improves liver health. Even small reduction in weight can lower fat content and inflammation. Physical activity. This is something that I talk to my patients a lot. It's good for your joints and muscles, but definitely, if you think about that, the movement would burn calories, which will also take up some fuel from your liver, fat deposits, and use it up, and that would lead to gradually decreasing your fat content on the liver. Both aerobic exercise and resistance training have been proven effective treatments for fatty liver disease. Now, in the integrative options of treatment, I would say omega-3 fatty acids, vitamin E, up to 1,000 milligrams, probiotics are being researched for their potential role in reducing liver inflammation. And I've seen some anecdotal reports of patients improving with it. Anecdotal is when those patients, I recommend them this treatment based on my information, knowledge, and they use it and I see improvement. Some herbal remedies like milk thistle, curcumin also have anti-inflammatory properties and liver protective effects, and you, under the supervision of a physician, can consider them. Now, there are some pharmacologic treatment options that are being considered, and treatment, obviously, this is reserved for patients who have exhausted their lifestyle changes and are needing medications. So among the pharmacologic treatments, your doctors may offer one of the diabetes medicine called TZDs. These medications like pioglitazone have shown benefit in improving insulin sensitivity and reducing liver inflammation. The side effects of this medication is not ideal. It causes weight gain, so it did not pick a lot of popularity. I have to say that in the recent 3 years, since we have seen the rise of GLP-1 receptor agonists such as semaglutide, Wegovy, Ozempic, and tirzepatide, Zepbound, they can help with weight loss, which I have been prescribing to my patients, and they also potentially improve fatty liver disease. I've seen patients showing improvement in their liver disease numbers with weight loss. Obviously, this these medications are reversing a lot of metabolic burden, metabolic syndrome, and we are seeing improvement. There's actually another drug that I haven't used yet, but recently got approved by FDA for treatment of NASH, and it is a thyroid hormone receptor activation, a process mechanism of action that it reduces the liver accumulation and improves liver scarring, and that drug is called Resdifra. And I will probably create some information about that drug when I get to chance to read and read about it. Some other under investigation potential options are pentoxifylline. The medication has been shown to reduce some fibrosis and has an anti-inflammatory effects. Blood pressure medicine called angiotensin receptor blockers, they've suggested some potential benefits. There are more medications in the pipeline that are coming along, but if you are one of the patients who either suffer for obesity, type 2 diabetes, hyperlipidemia, you have metabolic syndrome, um, there is some family history of liver disease, you have been told you have insulin resistance, um, and you may also consider patients who have polycystic ovarian syndrome, obstructive sleep apnea, hypothyroidism. Those are all the patients who are at increased risk of NASH. And if you are feeling that these symptoms are, these findings are seen on your labs, definitely talk to your doctor. Most of the common symptoms of NASH could be mostly it's asymptomatic. There's no symptoms of it. Fatigue can be a common problem. Right upper quadrant pain or discomfort can be another problem. Your liver might be enlarged because of the excessive fatty deposits. So medical and physical examination, even ultrasounds are good. So mostly laboratory testing like liver enzymes, elevated AST and ALT, they're the most common ways that you can see that your liver is being damaged. Imaging studies, ultrasound is a non-invasive test, easily can see that you can see that. You can also do something called um, there's a scan called FibroScan, which is a combination of blood test and the echogenicity of your of your liver. That can also be done. There are what they call non-invasive tests like fibrosis uh, scoring system through transient elastography, which is a fibroscan to see how your labs are. And I've ordered that in my patient population. Sometimes we are ordering MRI or CT scan for some reason, and then we see, oh, there's so much liver disease in this patient. Liver biopsy can also be another way, but we usually reserve that. We don't go for invasive procedures, but if needed, it can be done. So screening for this happens mostly when you end up seeing your doctor and they say, well, your liver enzymes are elevated. In any case, this is what's happening, and I am hoping that more and more patients would pay attention to their health and reduce their risk of developing obesity, type 2 diabetes, and improve their lifestyle. If you or someone you know who is at risk of NASH or fatty liver disease, it is crucial to work with a healthcare provider for a comprehensive plan for assessment and screening and monitoring, and and, um, and making sure that your liver health is back to normal. If you found this information helpful, please like this video, consider sharing it with someone that may benefit from it, and don't forget to subscribe to Youthful Medicine for more insights into managing chronic conditions of autoimmunity, metabolic health, obesity, and longevity and vitality medicine. Thank you. See you on the next video.